My name is James Monroe. Dr. Nate Smith did my procedures. We was having a family reunion at the house that Saturday. My great-grandkids was there, and they wanted to play in the treehouse. So I went ahead and blowed all the leaves off, and I thought, well, I'll get some boards right quick, and I'll refloor it for them where they play in it. And I don't remember making the step that I did, but I came down between two floor joists, and I could hear bones in my back. I thought, well, I broke my back.
Hello, my name is Dr. Nathan Smith. I am a cardiothoracic surgeon here at Magnolia Regional Medical Center in Corinth, Mississippi. So when I got the consult from Mr. Monroe, I quickly went over and looked at his CT scan and checked to make sure he was okay, and I noticed that he had more than 5 rib fractures in 5 ribs, and he was having a great deal of difficulty breathing. Now here at Magnolia, we offer a number of different therapies that aid people in dealing with the pain of rib fractures. First and foremost, we would like, if possible, to pull the ribs back together. And so I have a minimally invasive way of rib plating called the Advantage system that allows me to make a couple small incisions in the patient's chest, and then through a system of wires, pulleys, and plates, we actually pull the plates on the inside of the chest and reduce the ribs so that they no longer move, and it fixes the ribs back in their proper position. The second technology that we have at our disposal is something called the cryo nerve ablation. It's a system that I use when I'm doing heart surgery to do ablations within the cardiac chambers. We use this same technology to literally freeze the nerves. It knocks the nerve out of commission for about 3 months, leaves the structure of the nerve, but basically just numbs it for about 3 months while it grows back. And it takes about 2 to 3 months to completely recover from having a rib fracture. And so it just happens, it's the perfect amount of time to allow a patient to completely recover from the rib fractures. The icing on the cake of all of this is what we call multimodal pain therapy, where we have multiple doses of about 5 different medications that attack a patient's pain from all sorts of different locations, both in the way that we perceive pain in the ribs themselves, to our perception of pain up in our brains, and everything in between. The low doses of multiple medications avoids the complications associated with each of those meds, but almost completely controls the pain that patients feel.
We did that, and I'm thankful that I did, because I've had nothing but ease since we did that. If I had it to do over again, I would do the same thing that I did. It was a big relief. People that see me and don't actually believe that I had that much wrong with me at the time. But I'm thankful to Dr. Smith for doing what he did.